Hello and welcome to another episode of Discover with Spinati. I'm your host, Dr. Spinati. We're talking about CTS, cracked tooth syndrome. Yesterday, we talked about the problems that are encountered in the office on a frequent basis that most of you probably don't know about. But today, we're talking about something specific with regards to cracked tooth syndrome. Cracked tooth syndrome is something that occurs to people in a certain category according to certain things that happen inside their mouth. I had a patient, there's a story for you. I had a patient who she went to several dentists and they tested their tooth, and she had the symptoms that she had were that she couldn't chew on the tooth and it was hot and cold sensitive. And so they did a bunch of tests and then they said basically that she needs a crown or she needs she needs to have a night guard or something like that because it seems like that she is a grinder and clencher. Although they're not wrong, what they forgot to do, and this happens, we all forget sometimes, is they forgot to do the crack tooth test. Okay, so that was forgotten. And so what happened was when she came to my office and I looked inside the mouth, the tooth at that point was actually split. So it was easy for me to see because it was literally split. Okay, it was split in half. And she was telling me that it feels weird. It feels like the tooth is not normal. And so then when I looked at it, and obviously the tooth was fractured, like literally, like I separated the tooth apart, straight in the middle. I told her you have a cracked tooth. So what happened with her is that she ended up needing to get an implant because there's no way for us to save a tooth that's cracked in half, that's split in half. And so for us, at that point is that she needs an implant in order for her to maintain that space so that the teeth don't collapse. You don't have super eruption from the tooth that's above or opposing those teeth, and that she can function properly so that she can maintain a balanced bite. Now, why does that happen? Because I see it all the time. I see it quite frequently. Why does it happen? Now, there are two major reasons why I see things like this happen. One is grinding, clenching, and a deep bite. So when someone is grinding and clenching and they have a very deep bite meaning, they're putting a lot of stress. Okay, so the back teeth and the front teeth are basically all biting hard. Okay, so you don't have a balanced bite. There's no protective occlusion. So anytime that you move your teeth, anytime that you move your mouth, anytime that you move your jaw, you're actually engaging the majority of your teeth. And so then that's stressing all of your teeth. And so there are certain teeth that get cracked more frequently than others. Another thing that I notice is if someone has large fillings, if someone has a filling that runs through the tooth, okay, runs from the front to the back of the tooth, and a lot of people do, then that increases the chances of someone getting cracked tooth syndrome quite significantly. So what can you do? Well, number one thing for you to do is, and I talk about it all the time, is for you to balance your bite, because balancing your bite with orthodontics, whether it's braces or Invisalign, is the surest way to protect your teeth against getting these kind of cracks. Because once you get the fracture, once you get the crack, you have to replace the tooth with an implant. Now, the second thing that is recommended for you to do is if your dentist tells you that you're a clencher, you're a grinder, is to get a night guard right away. Right away. The only problem with the night guard is if your bite isn't balanced, you're using your mouth 2/3 of the day, obviously, but only 1/3 of the day, which is the night, you're sleeping, so you're protecting it with a night guard. Well, the 2/3, you're actually not protecting it. And some people say, yeah, I don't clench, I don't grind, but we do it sometimes just, when we're working, we're clenching, when we're doing certain activities, we're not actually paying attention to how our jaw is interacting. And it happens. So that's why the best investment you can do for your mouth, for your health, is for you to balance your bite. And that's number one. Number two, if your dentist recommends a crown because you have a large filling, do it. Because if you are delaying it and you say to yourself, I don't have insurance, I don't have money, I don't have this, they're very valid points, of course. But you also have to look at the alternative. The alternative is that if you lose a tooth, well, the implant, now you're looking at around $5,000, $6,000, or even more if you need grafting. And then surgery and time off from work and antibiotics and the whole 9 yards, as opposed to you just putting a crown that's probably $1,000, $1,500. So in terms of weighing your risk and benefit ratio of you putting a crown or you waiting to see when that day will come, it's not a good bet. So those are two things that I highly recommend you do in order for you to prevent having this cracked tooth syndrome, because I see it so frequently. And if you're a dentist, so pay attention to your dentist. Next time your dentist says something and he says, look, you have very large fillings, and he or she is going to recommend a crown. I recommend a crown. And if you say no, then you're taking the risk yourself. If your dentist says you have a very deep bite, you're biting, you don't have a balanced bite, right? You don't have a protective bite. Then you have to ask, how do I get a protective bite? And the answer, 9 times out of 10, is for you to get into orthodontics, get into either braces or Invisalign. So those are the two major things for you to consider in order for you to prevent the cracked tooth syndrome, so you can avoid having these nasty surprises. Because once you get cracked tooth syndrome, obviously there's no other treatment for it except for you to remove the tooth and put an implant. So prevention is better than a pound of cure, and an ounce of prevention is better than a pound of cure. And so pay attention to your dentist next time they talk to you and recommend things to you. If you have any questions, feel free to feed them to me. And if you have any kind of concerns as well, I'm here for you. And as always, keep smiling and have a wonderful Tuesday.